Uterine leiomyomas, also referred to as fibroids or myomas, are the most common pelvic tumor in women. They are non-cancerous tumors arising from the smooth muscle cells and fibroblasts of the myometrium. Why does one develop fibroids? Risk factors for fibroids include the following: genetics, your family history, race, early menstruation, eating a lot of beef and red meats, hypertension, alcohol intake, environmental exposure, and vitamin D insufficiency or deficiency. Regarding race, the incidence rates of fibroids are typically found to be 2 to 3-fold greater in Black women than in white women. Early age at first menstruation, less than 10 years old, is associated with an increased risk of developing fibroids. Hypertension is associated with an increased fibroid risk. The risk is related to increased duration or severity of hypertension. Environmental exposures such as phthalates, polychlorinated biphenyl, and bisphenol A appear to be linked to an increased risk of myomas, possibly through endocrine disruption. Significant consumption of beef and other red meats, or ham, is associated with an increased relative risk of myomas, and consumption of green vegetables and fruit, especially citrus fruits, with a decreased risk. Increases in dietary glycemic index or load are also associated with a small increase in fibroid risk in some patients. There is increasing evidence that vitamin D deficiency or insufficiency, which is more prevalent among Black patients, is linked to myoma risk. Consumption of alcohol, especially beer, appears to be associated with an increased risk of developing fibroids or myomas. Studies imply a familial predisposition to leiomyomas in some patients. There appear to be multiple different genetic pathways to phenotypic leiomyomas. Patients with HLRCC, hereditary leiomyomatosis, and renal cell carcinoma syndrome appear to be at increased risk of uterine sarcoma. Pathogenesis. How does it happen? Transformation of normal myocytes or muscle cells into abnormal myocytes through somatic mutations. Growth of abnormal myocytes into clinically apparent neoplasms. In summary, sometimes you are born with the genes that can cause fibroids. Try to eat less meat and eat more fruits and vegetables to reduce your risk of getting fibroids. If you are deficient in vitamin D, take vitamin D and avoid alcoholic beverages. Thank you for listening. Please click like, subscribe to Diseases Simplified, and ring the bell for more health tips and updates.